It is reasonable to say that once an infant has fed, they will have to toilet not long after. However, infants aren't always bothered by a wet nappy, and they can't just cry out when they need a change.
The baby cues are subtle and will take time to recognise for each individual child. If the infant is uncomfortable, they will often arch their back and stomach up and their face, and of course the more obvious cue, crying.
It is important to change the infant's nappy several times a day, as the infant often wees every 1 to 3 hours. An infant can pass a motion as high as 8 times a day and as little as once a day. Therefore, it is important to check and change nappies regularly.
When changing an infant, it is also important to look for their cues, as to whether they're comfortable in their clothing. They may be too hot, too cold, or the clothing may be too tight. Once again, crying will be the most obvious thing of discomfort or pain. Also be aware of the earliest signs, which is frowning.
Another sign that they're ready to be changed is lifting their arms up to be picked up and taken to the change table.
Hi, sweetie. Yes, you like this little piggy with the monkey?
Don't say Dad. Say Mom! Not Dad! Stop laughing! When changing an infant, it is important to respond to their need in a caring way. Some of these caregiving strategies include
Using the baby's name to establish familiarity and keep attention. Talking directly to the baby about what you're doing and explaining what is happening. Also, maintain eye contact and respond to any noises or smiles they may make.
Singing songs and playing games help build a positive relationship and keep the infant entertained so they don't become bored or restless. Be consistent with the child's routine, as it will reassure the child that their needs will be met.
I'm just going to wipe your hands. That's better. Just stay still.
Come on, baby. Let's go.
When new to the service, there are important factors to consider, such as stranger anxiety that they may be feeling. To establish a positive relationship with the child, pay extra attention and give them lots of positive reassurance for the settling in period. Work out the changing and dressing routine with the parents so that the child knows what to expect and feels more comfortable.
beware of any allergies, medication, and even if they have a special comforter that can help them with their transition into the service. To help them with the transition, encourage the parent to change the child's nappy at the service and also try to leave the child at the service for shorter hours at first.
Oh, yummy, isn't it? Oh, keep a little bit on your lips. Are you going to have
Beck, it's 9 o'clock.
Oh, is it already? Okay. Bye-bye, sweetie. Have a lovely day and Mummy will be back after work.
Come on, let's go wave bye-bye to Mummy. Okay. Bye, Mummy. Bye. Oh my god. Oh my god. Be back at 6:10. Believed that children develop trust versus mistrust at the age of birth to 1 year through the interactions of environments and carers. The infant learns whether the world is a trustworthy place to be.
Children are reliant on adults and they need routine and warmth with their relationships and interactions. If an adult meets the needs of an infant promptly, the infant will develop a sense of trust.
However, Unresponsive caregiving can lead to mistrust. Erickson believed that the way that the caregivers interacted with the child will affect them throughout life. By respecting and responding positively to the children's feelings and emerging skills, parents can support and promote children's social and emotional development.
Oh, darling, is it time for a nappy change? Oh. Come on.
When thinking of safety, we must ensure that the child and ourselves and others. Firstly, there is always a need of PPE, such as apron, gloves, and there is safe disposal of biohazard material into safe and out-of-the-way bin. Always cleaning the changing area is a must to avoid disease, illness and other contamination, as a changing area may be shared by other children.
Now there is also the infant's physical safety, as if they're not properly supervised.
Oh my God!
Make sure you have everything needed for the changing near you, but out of reach of the baby. If you do need to reach, keep your hand on the child at all times. Make sure you have
Place disposable paper towel on change area. Put on single-use disposable gloves and apron.
Hi Tina.
Hi, Beck.
Lisa's done a poo. I'm wondering if you can change it.
Of course I can.
Thank you.
Hello, Lisa. Have you done a poo?
Put child's bottom on the tail.
That's okay. We all do poos. Let's change our nappies. You can go and have a good day.
Remove nappy and soiled clothing. Then put nappy into the bin. Using disposable wipes, wipe from front to back. Remember, one wipe per cloth. Discard wipe and paper towel to bin. Remove disposable gloves, peeling back from wrists, without contaminating clean surfaces. Discard to bin. Don't forget to remove your apron. Put on and secure a clean nappy and dress the child. Throughout the procedure, interact with the child verbally. Talk, sing, smile, tickle.
It's nappy change time. Doo-doo-doo-doo.
Wash, wash, wash.
And now Lisa's all done.
Thank you, Tina. You did a wonderful job.
You're welcome, Beck.
Hi, Lisa.
Clean change table appropriately. Then wash and dry your own hands.
Be aware of the weather or temperature and dress the child appropriately. Being too hot or too cold is very dangerous for young children. Some signs that the baby is cold could be cold hands and feet and seeing veins on the baby's legs. Signs that the baby is too hot could be sweating in the area between their eyes and their ears.
Ladies and gentlemen, due to circumstances beyond our control, we are unable to continue our broadcast of dance music. We shall continue now with our piano interlude.
Place disposable paper towel on change area. Some people will go in hysteria unless it's just a little bit of wee. Now we need our PPE. Put on disposable apron and gloves. We'll put them down now, don't be rough. You have to safely lift the child. There's no excuse to treat them wild. Put child's bottom on the paper towel. Everything is happening now. Remove soiled clothing and nappy. Now that baby can be happy. Put that nappy in a bag or bin. Don't want no germs or smells to win. Disposable wipes on white per cloth. Wipe from the front to the back. You'll find it isn't hard to hack. Put those wipes into the bin. We're almost done now, almost a win. All this time, don't forget to sing. If you have a prescription, apply some cream. Everyone knows nappy rashes mean. Remove those gloves peeling from the wrist. This part's important, remember this. Don't contaminate, throw it in the bin. Getting closer to the wind. Secure a clean nappy and close ASAPy. Wash and dry the child's hand, followed by your own.